Brexit boost. Theresa May promises NHS an extra £20 billion a year, but there's a catch. The Prime Minister will today announce the country's healthcare system budget will increase by £20 billion a year by 2024, but the boost will come partly from the government hiking taxes and increasing borrowing by £11 billion. The £9 billion the UK currently injects into the EU is also expected to be diverted to NHS funding, which ministers are calling a Brexit dividend, to make up the rest of the costs. The plans are expected to be set out by her finance minister next year before a government spending review, the Prime Minister said. Mrs. May said who pays more tax, and how much, will be decided in a fair and balanced way. In a pre-recorded interview for LBC radio broadcast on Sunday, Mrs. May said, by the end of 5 years, in 2023-24, the NHS will be getting £20 billion, $26.6 billion, more in real terms that year, than it is today. She added, we take the advantage that we've got of the money we're no longer sending to the European Union, but also in putting the amount of money we want to put into the NHS for the future. I think we do have to look at contributing more. The 5-year settlement, which will see the NHS receive a £384 million per week, will enable the Prime Minister to say she has exceeded pro-Brexit campaign promises of a £350 million boost to NHS spending a week. During the referendum, pro-Brexit campaigners called for Britain to spend the £350 million it sends to the EU, on the NHS. The announcement comes in time to mark the 70th anniversary of the NHS, which provides free healthcare access to everyone who lives in Britain. Health Secretary Jeremy Hunt said the multi-million-pound cash injection was a fitting birthday present for our most loved institution and mentioned investing in technology to prepare the NHS for the 21st century. He added, the NHS is there for every family at the best and worst of times, from the wonder of birth to the devastation of death, living and breathing those very British values of decency, fairness and compassion. It recognizes the superhuman efforts made by staff over the last few years to maintain services in the face of rapidly growing demand. But it also presents a big opportunity for the NHS to write an entirely new chapter in its history. The funds will be largely used as part of a plan for the NHS for vital improvements to mental health, care services and other critical services. Neil Dixon, Chief Executive of the NHS Confederation, told BBC Breakfast the cash boost isn't a bonanza by any means, but added, it's a lot better than we've been used to over the last few years. He also cautioned the cash needs to be used to pay for more nurses and doctors, saying, you can have all the money in the world but if you haven't got the people to do the jobs then that's going to be a very significant challenge as well over the next few years. Figures last week showed over 500,000 patients have waited more than 18 weeks for their NHS treatment. A poll by Ipsos Mori, commissioned by the NHS Confederation, found 45% of people backed increases in national insurance to pay for extra funding for the NHS.